Thank you, Hannah, and thank you all for attending. I'm so excited to talk about poop. I talk about it at least 5 to 10 times a day, and it's a topic that I think will carry through life. So it's one that we definitely apply to many occasions. So I wanted to make sure I shared some tidbits with you. I wanted to thank Dr. Eva Taylor specifically also because she provided a lot of the slides from a webinar she did years ago. So if they so thanks to Dr. Eva Taylor, who is at the Sammamish office. I happen to be at the Redmond office and have been here with Allegro for 16 years. So I'm going to scroll through, and we're going to talk about so objectives for today. Basically, I want you all to understand normal and AB normal stool. We're going to discuss constipation and how to prevent and treat it in general terms. And most importantly, I do want to know when you need to step it up and talk to your pediatrician. So what this talk does not cover is is sort of chronic constipation, and we're not going to talk about specific treatment plans or get into details about treatment plans. So that might be constipation 201 or poop 201. So another talk. Okay, so time for a poll. Which represents normal poop? And I will give you all a chance to answer.
Looks like we've got a little bit of a delay with our polling, but I see answers coming through now. So
Okay,
it should
perfect.
pop up on everyone's
Take
screen.
your time. I'll just mention that while you all are doing this, that um, you may have seen this Bristol stool chart in the past. And this is a chart that we use in pediatrics quite commonly. And I thought it was named after Dr. Bristol, but it turns out that it's named after it was discovered or formulated in 1997 by two British doctors who attend Bristol Infirmary, I think is the name. Okay, so Bristol, okay, so this is good. So we have type 4, most people answered, and I am super impressed because that is, we're going to go on to the next slide and we're going to talk about normal poop. So yes, so normal poop is generally, our goal is Bristol 4 to 5. So many people run type 3, and that's actually considered on the constipated side. So our goal for all babies, for kids, is Bristol 4 to 5. And the normal range can be, 1 to 3 per day, could be one every 2 days, but we'll talk about what's AB normal, but that range is, a decent range. I think the exception are newborns and infants, because newborns and infants definitely they poop type 6 and 7, because that is the norm. It should be watery, loose, with some seedy little bits for breastfed babies. So that's normal. And they obviously can poop very frequently in the very beginning. After 1 month of age, breastfed babies can actually go 4 to 7 days and be considered normal. Okay, so what's AB normal stool then? So blood, so bright red blood, black and tarry stools. So black stools meaning like literally like the black of, black. So like my hair, black and tarry. Pale stools, or what we call acolic stools, are AB normal, and where they just don't have any pigment, we call them clay colored stools. Frequent or persistent diarrhea, so Bristol 7, except of course in the case of newborns, and constipation. So that's the one that we get called a lot about, but that's AB normal, Bristol's 1 through 3. So I will tell you that there are a lot of mimics. So food dyes, people who take ceftonir, for instance, it's an antibiotic. It can cause the poops to be red. I've heard that jujubes that are red sometimes can cause red stool, right? Beets, blueberries, iron cannot cause your stool to be quite black. But if you have concerns about if your child's having AB normal stools, please call our office, and so we can see your child. Okay, so let's talk about constipated stools, right? So this is where the heart of our discussion is. So we talked about the constipated stools being Bristol 1 through 3, so like those top things, hard and dry, painful oftentimes. Toilet clogging poop is generally big enough that it's considered constipation, and straining. So when your child has to strain to poop, that is considered abnormal and on the constipated side. The exception, of course, is the infants who are just learning how to pee and poop and feed and coordinate burping, and they oftentimes will hold their legs stiff when they feel that urge to poop, and that is counterproductive for pooping. And so so they look like they're straining, but that is just normal infant pooping. So ways you can help them are to loosen up their legs by bicycling their legs, doing a little bit of baby massage, but straining in infants is not considered AB normal, okay? All right, so let's talk about how to create that healthy and happy colon to prevent constipation. So it comes down to, I sort of try to distill it down to diet and habits because, and they're both probably equally as important. Diet, fiber, and water are absolutely the biggest things. Water norms, we can kind of go into like after 6 months of age when kids are starting solids, 4 to 8 ounces, 1 to 3 years of age, 4 cups of fluid, including water or milk, 4 to 8-year-olds, 5 cups. Older kids should have 7 to 8 cups of water a day, of fluids a day. It's really important. Fiber is just as important because fiber is what basically soaks up the water and helps make stool come to pass. And so I have a handout next about fiber, so we'll go into that in detail. Regarding the diet, there is maybe some imperfect evidence that whole foods, less processed foods, can help create a happy and healthy colon. Those foods with probiotics like kefir, yogurt, sauerkraut, kimchi can be helpful, and vegetables and fruits with peels. And so the next slide goes over what vegetables and fruits are quite helpful. I will mention a couple of things about this, about the diet. Bananas. No true evidence, but probably underripe bananas maybe tend to constipate. Overripe bananas may be helpful for constipation and give you a little bit of looser stools. I have to mention milk because dairy is great for proteins and healthy fats, but too much of a good thing is not good for the colon. And so 16 to 24 ounces after a year of age is plenty. It's good for calcium and vitamin D, but definitely more milk is constipating. All right, so let's talk about that other part, the habits. So this is just as equally as important as diet to creating a happy and healthy colon. So I always tell parents that listening to, or to pass on to their kids, that listening to the body is the most important thing. Kids and adults, we're busy. We can try to deflect going to sit on the potty when we feel that urge, but it's really important not to hold. Even 30 minutes of holding can tend to dry things up, and so don't suppress that reflex. Try and sit on the potty after meals. So there is a normal gastrocolic reflex that happens after meals. After eating, your stomach when it fills, it distends, your colon wants to empty. And so there's this it creates this gastrocolic reflex to try to stimulates the body to try to poop. And so you taking advantage of those times, sitting after meals is really helpful. And then squatting to potty. So normal, it's best to have like a sort of almost like a little bit flexed knees to, you can use a stool to achieve this with smaller kids to just make sure that their knees are kind of like up to in a squatting position that helps the colon line up better and make it easier to poop. Okay. All right, so let's go on. I promised you that list of high fiber foods, and so we talked about the fruits and vegetables, and this is a list that will, again, the slides will come to you, so you don't have to note this all down. But grains, cereals, whole grains, cereals, fruits and vegetables, and legumes and nuts and seeds tend to all be higher fiber. This is a link. This link here is a link to a Seattle Children's PDF that has all of these as well, and a list of high fiber foods. Fiber, I think I told you, works by absorbing water. It helps bulk up the stool. A handy fiber calculation for what you should be taking for fiber is the age of the child in years, and you add 5 to 10 grams of fiber per day. So a less than 2-year-old, maybe about 5 grams per day. 2 to 5-year-old, you need about 7 to 15 grams per day. School age, at least 11 to even up to 30 grams. Teenage boys actually need about 38 grams of fiber a day, which I was astounded by. Too much of a good thing is it does not necessarily help. Too much fiber can cause cramping. And so I think that we all under eat fiber. So I doubt that most people would ever get to the point where they're getting too much fiber, but too much fiber can cause cramping. Okay, so next slide. Let's talk about constipation. So that's the big one that as pediatricians, we probably, again, see, so commonly. I see at least a handful of kids a day who are constipated. So we talked about the high milk diet. So cheese and milk are good in small and decent quantities, but in higher amounts can cause constipation. It can cause those hard, pale stools. So you want to make sure you eat a well-balanced diet. Low fiber diet, right, can cause those small hard stools. The low fluid intake, it's rarely the only cause of constipation, but definitely low fluid intake can cause constipation. Lack of exercise, exercise gravity helps, which is why infants who start solids can tend to get constipated. So because gravity's not working in their favor. So if you're bed bound, definitely you can get constipated. Holding back stools because of pain and holding back stools because of power struggles. This is probably the most common reason that kids get constipated in that preschool, school age. And it's one stool causes pain, children will hold because they know that it hurts. And so they hold on to that poop, and then it gets worse and worse and worse. And so it's sort of a vicious cycle. So if you happen to, if a baby or a toddler has a strep infection around the anus, or they have a bad diaper rash, or they have an anal fissure because they had constipation and it tore, they will hold back stools because of pain. And then around school age is when you tend to get recurrent constipation because of just withholding behavior. So toilet training can certainly cause that. I have a handout about toilet training specifically, so we'll talk more about that. But at the beginning of school, when kids don't want to use the school toilet, they don't want to be seen in the bathroom, they will postpone stools because they're too busy, or they don't want to use a public toilet. Okay, so the most common times of constipation: when solids are being introduced, or cow's milk's being introduced, toilet training, school entry, and traveling, or you're out of routine. So those are the most common times when you see constipation. I will mention that some families actually do have just sort of slow passage of food through the intestines, and they can result in sort of what we call functional constipation. It's just slow transit time, and that tends to run in families. All right, so we talked about potty training being a big time when kids get constipated. And the reason why is because at that time, they're very prone to constipation due to withholding. So it's really important to aim for Bristol stool 5 during toilet training times. And if you sense that your child has any resistance whatsoever, they're not wanting to sit on the potty, they're withholding, they're asking for the diaper to poop, just listen to their cues and back off a little bit. So if it takes a little bit longer to get toilet training to happen, it's okay. It's better than to have a painful stool and start this whole process of constipation and withholding that is a vicious cycle. All right, let's move on. And okay, so now my kid is constipated. What now? So the poll we can have multiple choices on this. Okay, so most people, it looks like prunes and water. Yes, I love it. Okay, so prunes and water won out, and let's go to the next slide. So we're going to talk a little bit about constipation and treatment. So so in terms of home treatment, fiber and water absolutely are the big ones, right? And so we talked about that the earlier slides, how much water, how much fiber is necessary. Adding more water and adding more fiber generally doesn't treat things, but if you're under fibered and underwatered to begin with, it will help. So the pea fruits, especially prune juice, so pea fruits are pears, prunes, peaches, plums, those fruits with those peels. They work by having osmotic, they provide osmotic effect. And so that means they draw in water into the colon. And because it draws in water into the colon, it helps soften the stool. It has to correspond with actually drinking water too. So water still is important. The other treatments that at home that I commonly hear about that people are doing is osmotic laxatives. So Miralax, which we will talk about at length. It's the most commonly used medicine for constipation in kids. Miralax is a particular brand, but it doesn't, you can use the generic form of Miralax. And Miralax basically has the same effect as prune or the pea fruits. It has that osmotic effect to bring in water into the colon. Same with milk of magnesia. But Miralax tends to work more effectively because it's tasteless and odorless, and you can titrate it up and down depending on how much you need. There were some studies, there have been numerous studies about Miralax and its safety, and because it just stays in the colon and brings in water, it does not absorb systemically. It is considered safe, and it can be used long term as well. Lactulose is not available over the counter, so it can be part of our regimen that we use, although people have gotten away from using lactulose just because Miralax is so commonly available and easy to tolerate. We do try to avoid stimulants, which is X-Lax, Senna, Biscoital, which is Dulcolax, castor oil, and Cascara, which are sort of old school natural remedies that we try to avoid, and enemas we try to avoid unless they're really recommended by your doctor, because long-term and frequent use of stimulants which is the squeeze it squeezes the gut of the colon. They can be more habit forming, and the muscles can become dependent, and so we tend not to use these long term, or we avoid using these long term. So let me go on to the next slide, which will show us it will kind of visually explain how all of this works and how constipation happens. And then I'll answer some questions. So the normal colonic motility. So this is a pictorial of a colon. This is that attaches to the small intestine in the stomach, which you don't see. But this is the end of, so this is the ascending colon, transverse colon, descending colon, sigmoid, and rectum. This is where the poop comes out. So when food enters, then when poop enters into the colon, it's actually kind of liquidy after being processed by the small intestine. And the water, as a poop passes through, comes out, okay? Which is the reverse is also true, is that you can bring more water into the colon by using Miralax or those pea fruits to have that osmotic effect. These red things are the squeeze. So this is where it propels, or peristalsis, the colon squeezes to move that poop along. So as watery poop comes through, it's more water's coming out, it's squeezed along, and then it forms. So as it goes along, it forms into poop as we know it, and then gets pooped out, right? But the longer it stays in the colon, the harder the stool gets. The less water that's getting that's behind left behind in the colon, the more dry it becomes, right? So what happens when you get constipated? Oh, I should mention one other thing. Sorry, this slide shows the stomach overlying the colon. Again, a rough pictorial, but the stomach does overlie the colon. And so when your colon is squeezing, or when you're constipated, it pushes up on the stomach, and sometimes you can feel nauseated and even vomit because of constipation. Okay, so constipation. So when that colon gets constipated, liquid, water's coming out, not enough water's coming in, gets harder and harder, or not enough fibers, so they're bulking it up, and the stool gets harder and harder. The stool will accumulate and cause the colon to distend. So the colon has fibers, muscle fibers that are really, it's almost like a rubber band. It stretches really easily. And so this will just, as poop just backs up here, it'll stretch and stretch and stretch to accommodate it. Sometimes even diarrhea can come around those hard stools, and the muscle fibers and the nerve fibers also get stretched. And so in chronic constipation, we'll almost see that colon get dilated, and then the poop gets stuck, right? And just backs up. So when we treat constipation, we're often treating we're treating both trying to clean out. So we're going to treat with both higher dose osmotic laxatives like Miralax and a squeeze medication to try to push all of that out. But the most important thing over long term is that we have to get that gut back into a healthier position, not stretched out. And so getting back to a happy colon is all about fixing the quick part, which is the clean out, but then getting back to its happy place. So allowing a really nice emptying of the colon in a routine fashion. So that part takes time, which is why when we see kids in the hospital or kids in clinic with lots of constipation for a long period of time, we're telling kids that they may need to be on treatment for 6 to 12 months because it takes so long to get back to a happy, healthy colon. All right. So we're going to our aim with chronic constipation is keeping stools nice and soft. All right, so this is our end of today. And we have 4 minutes left. I'm going to leave you with a couple of things. Just call us for concerns about AB normal poop. Treatment plans definitely can need to be individualized, especially if your child has chronic constipation. And so I will happily take any questions about poop.
Great, thank you so much. Our first question here is a clarification on bananas. You mentioned
Hmm.
that sometimes they're helpful for constipation and sometimes not so much. So if you could clarify that point.
Yes, so underripe bananas can tend to constipate a little bit. Overripe bananas can actually help a little bit. So sometimes it helps with constipation. It can actually help with make runnier stools.
Perfect, thanks. And then we have a question from a parent of a baby about introducing milk and if there is any signs that you should switch to a non-dairy milk.
Okay, good question. First of all, we suggest switching over or adding cow's milk at 1 year of age, but not sooner because the infant gut has difficulties processing those milk proteins before that. Yogurt and cheese are processed or are broken down enough, so that's okay before 1 year of age. Once you start milk, again, limiting the amount of milk to 16 to 24 ounces max. I usually even go for like 16 to 20. But if you're having really firm poops or you're having really, discomfort, then I would certainly talk to your pediatrician. If you want to try alternative milk sources, you certainly can. Although I will say that of all the alternative milk proteins out there, pea protein probably is the only one that has pea protein, and maybe hemp protein has the only equivalent to cow's milk protein. Everything else, the protein content is much lower and there's quite a bit of sugar.
Great, thank you. We have a few people reaching out with questions, concerns about potty training and poop. If you have any tips on helping with potty training and
Yeah.
encouraging your child to sit on the potty for longer.
So with potty training, I really encourage people to, I think, make it a habit. So bring kids in when you're going, so they understand. Bring kids in, try to, anytime there's a transition time, try, like we're going to go outside to play. We're going to go off to school for preschool. We're going to go off to do, we're coming back from being outdoors. That's a time to say, hey, let's go sit on the potty, right? It's potty time. And then right after meals, of course, and right after meals is another good time to sit. And then encouraging them to stay longer. That's a difficult one, but sitting with them sometimes can help. I try to avoid actually doing a lot of like reading or doing screen time on the potty because I think it just detracts a little bit from what's going on. And so I just do potty time. You can sometimes set timers if they're willing to. And then I always reward for potty training. So rewards can go a long way. So it could be like a small piece of small M&M for just sitting, and then more 2 M&Ms for producing anything. But I do reward rather than punitively, for sure. No, never force anyone to sit on a potty if they don't want to.
Great, thanks. And then one last question is all we've got time for, but it's a good one. So wondering if you are noticing that your child is constipated or having runny poops, how long do you wait until you say contact Allegro?
So I would certainly say like for a few days, or up to a week, if you're not experiencing extreme pain and there's no vomiting and their appetite is unchanged, then I think you can concentrate on the fiber and water, and making sure that that's adequate. But if you're going beyond that, then I definitely think that, or there's symptoms of, so you're going beyond 5 to 7 days and or there's symptoms of pain, vomiting, their appetite's down, they're not pooping at all for the 3 or 4 days, and I think it's reasonable to come in to see the doctor.